So yesterday we read in the papers how 50 people, more than 50 actually, have died because of a strange illness in Kogi State. The State Assembly is seeking help to stop the spread of these diseases. Some of the symptoms of this unknown disease come with headache, red eyes, loss of appetite, inability to urinate or defecate, convulsion, and death. On the show this morning, we have the Commissioner of Health in Kogi State, Dr. Saka Haruna, joining us. Good morning, sir. Are you there?
Thank you. Good morning.
Good to have you on the show. Sir, we're quite worried about the reports we're getting from Kogi about the people that are dying, and it seems like nobody knows exactly what the cause of death is. Could you give us an update?
Thank you. I first want to appreciate you for trying to clarify the information that you received from social media. Let me draw your attention to a publication from Kogi State, from Enugu State Ministry of Health on 5th November 2020, where the Honorable Commissioner for Health Enugu made a call of alleged unusual death in Eteuno and Umoku communities of Enugu State in a decade town in Igwe, the North local government area of Enugu State.
Yeah.
And they did deploy a team of public health professionals to those communities. Samples were taken and were sent to NCDC, and it came out to be yellow fever hemorrhagic disease. So there's no doubt, there's nothing unknown about. We already know. It's just that the communities affected are in Enugu State, not in Kogi State.
Okay, but it seems like the government doesn't have the capacity to contain it, because for 50 people to have died in such a short time. What do you think is being done to ensure that at least people within that community have access to proper health care?
They already have access to proper health care in that local government, Olomaboro local government area, where 80% of the community affected, the Kogi part of it. They have a primary health care, they have a cottage hospital, and a general hospital in the same local government area. We have at least not less than 10 PHCs in that local government. So I really don't know why many people insist on peddling false information about Kogi State.
Okay.
Kogi State is very, very familiar with the outbreak of yellow fever, because we have had this in 2017. The team of public health professionals in collaboration with our health development partners, WHO, AFINET, NCDC, and we had yellow fever vaccination in that local government, Yaba West local government in 2017, and contiguous local government area like Lokoja and Yaba East local government area.
Okay.
The adjoining local government areas from Parasit also had this vaccination effort. And in 2018, we extended this to entire states, including the people in the community you are referring to.
Right.
So yellow fever vaccination has the capacity of protecting individuals.
Okay.
It can confer immunity for up to 10 years post-vaccination.
Okay, so that's good to know.
I think this explains the reason why our people were relatively spared.
Okay, let me take a few more questions.
Okay, so I'm happy you're clarifying this. What we read was that people died in Kogi State. You're saying they didn't die in Kogi State because they already have yellow fever vaccinations. I just want to have that information clear from you. Are you saying that Kogi citizens didn't die?
It was Enugu.
That is right.
It was, this story was from Enugu State.
Enugu State. And Enugu State had earlier made a press statement about it on 5th November 2020.
Okay, all right.
Okay, so the vaccination that's taking place also ensures nobody within your state's experience. Is it still ongoing? And is it free?
We had that the vaccination was, the exercise took place in 2018. But what we are trying to do now, even though we have not had any unusual death or unusual symptoms that can be classified among the hemorrhagic viral fever, we are currently planning to vaccinate those individuals that must have missed that vaccination exercise in 2018.
Okay.
But I can tell you that our people have immunity because of that statewide vaccination exercise in 2018.
I guess we'll have to invite the Health Commissioner for Health in Enugu State to give us some clarity.
Yeah.
But you don't want to wrap up with him? Or have a
no, I'm just saying, I'm wondering where the journalists got the story from, that it was Kogi State. Because we had heard about Enugu State, we'd heard about Delta State, and then Kogi State is the latest in the... So, and you are saying it's not Kogi State. So we will need to invite the journalists.
That's what I'm saying.
Okay.
My team has been... Hello?
Yes, we can hear you. Go ahead, please.
Our rapid response team has been there twice within the last 2 weeks. The last time they were there was on 7th of this month, and we have been having telephone conversation with our contacts there. You see, there is a peculiar pattern of channeling information within the health ministry. As far as disease outbreak is concerned, we have informants, the focal persons, per ward across the state. We have 239 wards across the state, and we have an informant in each of these wards. The informant reports any rumor of outbreak to the local government DSNO, who in turn pass such information to the DSNO at the state level.
All right.
The DSNO at the state level process and pass it through the state epidemiologist, and eventually it will be on my desk, the office of the Commissioner for Health.
All right.
So there is it's not possible that we need an outbreak of this magnitude.
But the story was revealed by a lawmaker. And I mean, we know the Kogi State, when COVID started, your state in particular denied that COVID even existed in the first place. So we are just a bit worried that we just hope that this is not another cover-up from your state. That's our worry.
Is there any cover-up in the past?
No, we just heard that, COVID, your governor never admitted, was saying that we're focusing too much of our resources and on COVID-19. That we shouldn't. I mean, remember that this is in
and like Mariah said, it's not from the. It's from your APC Alamoboro Anthony Uja. It raised the issue on the floor of your state assembly. So I'm sure that this is something that you probably want to check within the state, because he's the one. It was raised from the floor of your state assembly. We will take what you say, because of course we have you on tape, that you are saying there's nobody dying from any strange sickness in Kogi State, and Kogi State is safe from yellow fever because everybody has been immunized in 2018. So we'll take your word.
Are you sure everybody took the immunization?
Of course, not. It can be. I have to make this clarification. Please get me clear. Let me make this statement that it is not possible to vaccinate entire population.
Of course. Yeah.
There are eligible persons, and they were all vaccinated. This vaccination, those eligible must be from the age of 9 months upwards. So there were people then that were below 9 months. So that's why we are planning to go there to seek for those people, to sort out the people that missed the previous...
I have to let you go at this point, but thank you very much for joining us. As Tokwe said, we'll take your word for it and see what happens going forward. But we will keep our eye on Kogi State and possibly also Enugu State. Thank you very much, sir, for joining us this morning. We appreciate your being here. We've gotten a message from the Enugu State Commissioner for Health, Professor Ikechukwu Emmanuel Obi, and he says that the community affected, concerning the 50 that died, the community affected is Ete community, a border community with Kogi State. Enugu has taken responsibility and visited and commiserated with the family, taken samples, confirmed yellow fever, reported this, and started yellow fever treatment and control measures within that community in Enugu State. So I'm happy the Commissioner of Health in Enugu State has taken responsibility, and they're ensuring that those people within that community are well vaccinated and treated for against further infections. So that's good.